Hey guys, I'm just waiting for a few more people to hop on. I'm going to be talking about craniosacral fascial therapy today, if anyone's interested. Let's just wait one more minute. Alright. Hey guys, my name's Joelle Carrera. I'm going to be talking today about craniosacral fascial therapy, also known as CFT, which is a modality that is basically a mix of craniosacral therapy along with myofascial release. And so, that starts out with my first question. What is CFT? It's basically a mix of those two modalities combined, and they were discovered. CFT was discovered by Dr. Barry Gillespie, who realized that the craniosacral system and the fascia system is actually two interconnected systems that is better to be worked on together than worked on separately, essentially. And so basically what to expect with CFT, it's this very gentle hands-on technique where I will hold your head or a limb or some part of your body and basically just hold it and let it allow to unwind and untwist whatever tension is there. And generally people leave with more range of motion, easier to move, and really a number of things, which is pretty cool. And so a lot of people ask me, what is the fascia? Well, the fascia is basically this clear-ish substance that basically encapsulates and surrounds every organ, every cell of your body, every nerve. And so what I do is I'm primarily working with the fascia along with the craniosacral system, so that as I release the fascia that's surrounding the craniosacral system, and let me back up a little bit. So the craniosacral system, for those who don't know, is the system of spinal fluid that goes around your brain and up and down your spinal cord. And it's supposed to be going at they call it a brain cycle, where your brain is basically pumping the fluid up and down your spinal cord. And so what I'm doing with the fascia is I release the fascia, and it releases the tension on that cerebral spinal system. And basically, the more I release it, the more free-flowing that brain cycle is able to pump that fluid up and down your spinal cord, essentially getting all the oxygen and nutrients to all the cells in your body and all the nerves in your body that may not have been getting as good of oxygen as before. And yeah, it's just really cool to see all the different things that it can help. And yeah, and so basically what to expect when you come in for a visit is for me to just gently hold a part of your body and gently unwind it. And so it's a gentle hands-on technique that works to unwind and release the tightness in the fascia to facilitate a freely moving brain, spinal cord, and fascial web. And more about the fascia. If you can imagine an orange, and the white part that's connecting all the orange slices together, that is like the fascia. And the fascia is an all-encompassing web of connective tissue that structurally supports to protect the body as a whole. And it also is a transport system to nurture and detoxify the body. And so generally, um, it's really, no one knows what's going to happen exactly after each session, but we just know that we are releasing the fascia, and how it comes across for that person is different, person by person. And so some people may feel good afterwards, some people may not feel so good afterwards, and all of that is normal, because unfortunately, as we're releasing the fascia, depending on the person and how long they've had different types of ailments, it could cause a healing crisis, which is essentially basically where a person could have a flare up of whatever they have to deal with on a daily. And so um, yeah, and so even though it sucks to feel like you're going backwards, it's just part of the process of the body unwinding itself. And then also, it is possible for people to have detox symptoms from it, because as I'm unwinding the fascia and releasing it, I um, I basically toxins can be releasing also, because I'm releasing the lymphatic system, and so much more than is even comprehensible. But it's just really crazy how it is all interconnected. And so that so some people ask me, what's so important about it? Why do we care about the fascia? Why do we want it loose? Like, and obviously I told you about the brain cycle. And so basically, the reason why it is so important is because the fascia is connecting from your head to your toe. And sometimes the fascia that is affected on one half could be affecting the other half. Like, for example, if you had a knee injury, you could be experiencing shoulder pain, which sounds bizarre, but it's just how the fascia works. And so that's why a lot of times that people have like a shoulder injury and they go, obviously it's different for every person, but a lot of people will go to the chiropractor or the massage therapist, and they'll be focusing on this one area for so long, and they never get the results that they want. They still are dealing with the same issues. It might feel a little better for a few hours after a massage, but with the fascia, I'm unwinding whatever's causing that strain, instead of just trying to massage the muscle to make it feel nicer. And so, yeah. Um, and for anyone who's new here, I just wanted to say that I'm talking about CFT, which is a craniosacral fascial therapy, that can work with a number of things. Yeah, whether you have body aches, it can also help with anxiety, depression type symptoms, because the fascia is connected to the brain, and so forth. But so where I was going, why is it so important? Well, for starters, the main part of the fascia that got me into CFT, which is the part that's right underneath the tongue, it looks like a little white line. Most people have it, at least. It looks like a little white line that is basically connecting the tongue to the bottom of your mouth. And so basically, if your tongue isn't able to be at the top of the roof of your mouth when you're sleeping, then you aren't able to, then you're most likely mouth breathing. And the reason why we don't want to be mouth breathing is because you're basically breathing unfiltered air, because our noses are a filter. And so if you're not breathing unfiltered air, that air could come in and damage something like your tonsils, like I had when I was 10 months old, and so forth. And so if your tongue's not in the right position, that means that your palate of your mouth isn't able to form correctly. It's not able to expand naturally as it's supposed to fit all the teeth. And then if it's not in the right position, then your airway doesn't form as big as it's supposed to be. That's when you hear people saying like, "Oh, you got a small airway," like my dad. And then also if the tongue is in the right position, then it also affects how your sinuses are developing, not to mention the structure of your mouth developing. And so it's just very interesting. And I really encourage anybody who's interested to check out our website, or also check out Dr. Gillespie's website, which is the GillespieApproach.com. And basically he built that website to share all of his testimonials, and just to share the joy of how this simple modality is really helping a lot of people, especially babies, whether they're just having trouble latching or they're just not happy babies for some reason. And yeah, and it's kind of sad though, but babies, we don't know why they're crying most of the time, but Dr. Gillespie's found that the babies just have some sort of tightness in their bodies, and a lot of it is caused just from being in the womb, whether they were not able to move enough, or they were stuck in a position for too long. All of that limited their body from being able to move and stretch and unwind the fascia naturally. And so yeah, and then let's see, what else is there to say? There's a lot to say about this, but it's just a matter of where to start, because this is like a can of worms that is just exciting to open, because once people know that it's a thing, that they know that there's more than one reason why they could be having headaches or shoulder pain or back pain. And for myself, I guess I'll share a little bit more about me. The reason why I got into fascia, or CFT to be specific, is because a month before I conceived my baby, we were trying for a year and a half to figure out like what was going on. My diet was on point. There wasn't really a thing that was like flashing lights of why it's not happening. And then all of a sudden I come across on Facebook, on Instagram, a picture of somebody's bloody tongue. And so that bloody tongue, basically the caption said, as I released their client's tongue, the client felt her shoulders relax. And then as she walked out of my office, she said her hips released. And that just put flashing lights in my brain. And then I had to figure out, then I researched about tongue ties and all that fun stuff. And then I got my tongue tie done. And lo and behold, a month later, we conceived. And we had been trying to figure out for over a year why I felt like I had to go to the chiropractor every week. And then after I got my tongue tie released, I felt like I could go every 3 to 4 weeks, which is just huge. Going from an adjustment lasting a few hours to an adjustment lasting 3 to 4 weeks is major news. And so when my baby was born, I had a feeling that it was going to happen where he was going to have a tongue tie too, and he did. And so he's really the reason what got me into CFT. And just from taking the training, and my baby being a part of the training, one of the volunteer babies, he before CFT, he felt like when you pick him up, you pick up the baby, and then like the pelvis comes. Like it's not like felt like he was all connected. It's really weird to say, but after the first session, you could feel like his body was solid, and it wasn't like a slinky where you pick up one part and then the rest of it comes. And that was just one of the benefits that I noticed with him. And then also after a few sessions, I noticed that he started saying more sounds, and instead of just repeating the same sound, he was also mixing the sounds. And now he's saying dad, and so many other things. But yeah, and then those are the few that I can think of off the top of my head. But yeah, and then I guess I'll just say one more testimonial, which was just after like 2 30-minute sessions on my husband. I basically, I wasn't expecting anything, you know. I like to say, if before we decide like if this is going to work for you or not, give me at least 4 sessions so we can see what your body says. And for my husband, just after 2 short 30-minute sessions, just playing around, I wasn't really like trying too hard, and and the second night, after he woke up, he said that he slept better, and then also he said that he felt like he had more range of movement in his neck, which he said normally when he woke up, he felt like he had a lot of tension where he could like barely go back and forth. And I mean, that's just after 2 30-minute sessions, guys. So I feel like there's a lot of potential here for a lot of people. And let me flip open my book real quick because I want to read off what the CFT can benefit for for different people, whether depending on what your situation is or what you've been having to live with. So let's start with talking about causes of tightness in the craniosacral fascial system. And so, like I mentioned, positional strain in utero, birth trauma, whether it was too fast of a birth, too slow of a birth, or the cord was wrapped around the neck, etc. Falls can cause trauma to the fascia, surgeries, accidents, concussions, dental and orthodontic procedures, and then also emotional trauma can be stored in the fascia. And so a lot of times, or sometimes when releasing the fascia, people can have emotional releases, whether they cry or experience some type of emotional thing that's releasing. And so let's start with infants. Some CFT conditions that CFT can help with would be lip and tongue tie, torticollis, reflux, colic, inability to latch, difficulty suckling, difficulty sleeping, constipation, head asymmetry, earache, general fussiness. And I just want to go back to the tongue tie, lip tie thing that I just mentioned. And so the reason why fascia is good before you do a lip or tongue tie release is because basically we want to bring the fascia forward so that when they go to do the release, they have more to cut, and they also have a better release. And then also after doing the body work, it's possible that babies or people may not need the tongue tie release. It just depends if it's still affecting their function, whether it's eating function, talking, speech functions, so forth. And then so some childhood conditions that CFT can help with would be asthma, earaches, concussions, ADHD and ADD, learning disorders, sinus conditions, autism, anxiety, neck pain, digestive issues, bedwetting, headaches, and scoliosis. And so basically, to further explain, the fascia is an underlying component that can be contributing to these ailments or diseases in the body. And so for adult conditions that CFT can help, headaches and migraines. I want to stop on there real quick because I feel like this is such a thing nowadays that almost 1 in 5 people that you hear about, they either have headaches or migraines. And why? And they take all these medications, and essentially it's not getting to the root cause. And so to put it into a picture, how can the fascia affect headaches? So like I said before, I think I said this, there's 4 major fascia lines throughout the body, and basically one of those fascia lines, at least one of those fascia lines, is connected to the brain. And so basically the fascia can be pulling on the brain, causing these headaches or migraines. And then beyond that, it can also help with concussions, TMJ, back, neck pain, digestive issues, hip pain, sinus conditions, anxiety, depression, sleep issues, airway issues, poor range of motion, high blood pressure, whiplash, sacral dimple, scars, vertigo, dizziness, ringing in the ears, arthritis, um, and then any dental procedures. So your gums, all of your gums are considered fascia. So every time that you get a tooth pulled or a filling filled, it's doing something not that great to the fascia. Um, and yeah, and then to touch back. Well, I guess I didn't mention it, but it can also help with. I mentioned sinus conditions, but I was thinking it could also help with allergies, because basically, if the nerves, the sinus nerves, are being compressed and tight because of the fascia, then releasing the fascia can release those the fascia on the nerves. And if the fascia is super tight on those nerves, or any nerves to be frank, then basically it could be causing sensitivity in that area. And then also I and then also eyesight, because if the fascia is too tight and closing off those nerves on the eyes, then that's when things start to go downhill. And I hear a lot of these things that people just chalk up to old age, but essentially there's always another reason, or a root cause to these old age symptoms that essentially are just based off of years of life and trauma and surgeries and tattoos and scars that just build up over time. And yeah, and so to touch on a little bit how that happens is basically, if you imagine your fascia is like this layer of yourself, that when you get in a car accident, when you fall down the stairs, your fascia basically takes like a imprint picture of where you were when you were in that car accident or fell on the floor or whatever it may be. And basically, if the fascia is not able to release itself by itself, then over time the fascia just builds on that layer, and that layer is like not a good layer. It's basically a layer that it was just a moment of time that eventually gets built up, and then that's when people aren't able to move as freely as they once were because of life. And yeah, it's unfortunate that some people have it worse than others, but essentially I believe it comes down to the fascia. And obviously there's multiple different things that can help the symptoms that the fascia is causing, but if you are like me and like to get to the root cause of it, I'd love to help you too. But yeah, I'd love to do another Facebook Live, answer some questions that anyone might have. These are just some of the basic questions that I get already, but if anyone has any questions, please leave a comment, and I'll have to get on here again and talk about them. But yeah, again, my name is Joelle Carrera, and I work at the Natural Healing Center in Newport Beach, and this is CFT, Craniosacral Fascial Therapy. Thank you.